Kidney stones can strike at any time, and the pain they bring is not just discomfort. It can completely alter your life. Millions of people face excruciating pain every year, and many of them don't know where it comes from or how to prevent it from happening again. When kidney stones appear, they are not only a physical issue, but also a shock to your mental and emotional well-being. This is not just pain, but a challenge that forces you to make important decisions regarding your health. From the first symptoms to the most modern treatment methods, you will have all the essential information at your fingertips to protect your kidney health. Once you fully understand the causes, symptoms, and prevention methods, you will no longer need to worry about kidney stones. Stay tuned to avoid missing out on valuable information on how to prevent and effectively treat kidney stones. What are kidney stones? Kidney stones are a common urological condition, especially in middle-aged men. The typical age range for the onset of the disease is between 30 and 55 years old. Men often have a more complex urinary tract structure, so the stones are usually harder to pass compared to women. Kidney stones are solid particles formed by the natural crystallization of inorganic crystals in the urine. They can cause pain, nausea, vomiting, blood in the urine, and may lead to fever and chills due to secondary infections. Most kidney stones start forming in the kidneys, move along the urinary tract, and are eventually excreted, which is why they are commonly referred to as kidney stones. When the urinary system begins the process of sedimentation and crystallization of stones, the small crystals and stones usually travel through the urinary tract and are excreted. However, at some point along the urinary pathway, the crystals or stones may get stuck, continue to crystallize, and grow into larger stones. 2. Symptoms. Kidney stones often do not cause symptoms right when they form. However, when the stones move or become stuck in the ureter, they can lead to very noticeable and painful symptoms. The pain from kidney stones is often described as extremely severe, usually starting in the lower back or side, and can radiate down to the lower abdomen or groin. This pain can come on suddenly and last for an extended period, making it difficult for the person to find a comfortable position. The pain worsens particularly when the stone moves through the ureter. In addition to pain, another common symptom is blood in the urine. When the stone rubs against the ureter walls, it can cause small tears and lead to hematuria. Some individuals may also experience urgency or frequent urination, but are unable to pass much urine. This happens when the stone is near the bladder or at the end of the ureter, creating a sensation of needing to urinate but not fully emptying the bladder. Occasionally, kidney stones can also cause nausea and vomiting, especially when the pain becomes more intense. 3. Risk factors. There are several factors that can increase the risk of developing kidney stones. The most important factor is dehydration. When the body is not properly hydrated, urine becomes more concentrated, and the waste products in it are not diluted enough, making it easier for them to clump together and form stones. Another factor is an improper diet, especially one that is high in protein, salt, and sugar. These foods can increase the levels of calcium and acid in the urine, creating a favorable environment for kidney stone formation. Family history also plays a significant role in increasing the risk of kidney stones. If someone in your family has had kidney stones, you may have a higher risk. This suggests that genetic factors can influence the likelihood of developing kidney stones. Underlying conditions such as diabetes, obesity, or gastrointestinal disorders like Crohn's disease can also increase the risk of kidney stones. These conditions can alter the quantity and composition of urine, which can facilitate stone formation. Lastly, age is a risk factor. Older adults are more likely to develop kidney stones as kidney function can decline over time, increasing the likelihood of stone formation. 4. Diagnosis. When a patient suspects they have kidney stones, the doctor will perform a series of tests to determine if kidney stones are present and assess the severity of the condition. The first step is usually a urine test to check for blood or signs of infection, which is an important indicator of the presence of kidney stones. Ultrasound is the first imaging method used to diagnose kidney stones, particularly for younger patients or those who need to avoid X-rays. Ultrasound can help detect stones in the kidneys or ureters, But it has limitations in detecting stones in hard-to-see areas, such as in the ureter, where intestinal gas may obscure the view. If more accuracy is needed, a CT scan is the next imaging method, as it allows the doctor to clearly see all locations of the stones, including small ones and hard-to-detect areas. CT scans are very useful in determining the size, shape, and exact location of the stones, helping the doctor decide on the appropriate treatment method. In some cases, if the patient has unusual symptoms or requires a more detailed diagnosis, the doctor may recommend additional tests, such as X-rays or blood tests, to check kidney function and other health indicators. 5. Treatment methods. When diagnosed with kidney stones, the treatment approach depends on the size, location, and severity of the stones. For small stones, doctors typically recommend drinking plenty of fluids and taking pain-relieving medications to help the stones pass naturally through the ureter. Certain medications, such as alpha blockers, e.g. Flomax, may be used to relax the muscles in the ureter, making it easier for the stone to pass. Larger stones, or those causing a blockage in the ureter, generally cannot pass on their own and will require intervention. Shockwave lithotripsy is a common treatment method, which uses sound waves to break the stones into smaller pieces, allowing them to be easily excreted through urine. This method is very effective for stones of moderate size. For large stones or those located in difficult-to-reach areas, doctors may perform a procedure called ureteroscopy. During this procedure, a flexible tube is inserted through the urethra and bladder to reach the stone. A small camera attached to the tube allows the doctor to visualize the stone and use a laser to break it into smaller pieces, or employ a basket to remove the stone. In cases where kidney stones cause significant obstruction or pose a risk of infection, surgery may be required to remove the stones. This surgery is usually performed when other treatment methods are ineffective or when there is evidence of kidney damage. 6. Emergency situations. Kidney stones can become an emergency if they cause severe obstruction or lead to infection. One critical emergency sign is when the patient develops a fever. If the kidney stone blocks the ureter and urine cannot drain, bacteria can rapidly multiply in the urinary system, leading to an infection. If the infection spreads to the bloodstream, it can become life-threatening, and the patient needs immediate treatment. In addition to fever, unbearable pain is another sign that requires emergency care. The pain from kidney stones can come on suddenly and last for an extended period, with no position providing relief. If the pain becomes severe and cannot be controlled with regular pain medications, the patient should go to the hospital immediately. Another emergency situation is when there is uncontrolled blood in the urine. This often occurs when the stone moves and rubs against the ureter wall, causing bleeding. While blood in the urine is not always dangerous, if there is a large amount of blood, or if it doesn't stop, immediate medical attention is required to prevent complications. Finally, if kidney function is impaired, the patient may experience a condition where urine cannot be excreted, leading to water retention in the kidneys and long-term kidney damage. This is a very serious situation that requires prompt medical intervention to avoid permanent kidney damage. 7. Prevention. Preventing kidney stones is an important part of protecting kidney health. While it is not possible to completely prevent the formation of kidney stones, there are several measures that can reduce the risk of developing them. Drinking enough water is the most important preventive measure. When the body is adequately hydrated, urine becomes diluted, which helps prevent the formation of crystals and stones. The goal is to drink at least 2 to 3 liters of water each day, or more if you live in a hot climate or engage in regular physical activity. This ensures that the urine is not too concentrated, reducing the likelihood of waste products clumping together to form stones. If you often feel thirsty or show signs of dehydration, you should drink more water immediately. Adjusting your diet is the next important factor. Limiting the intake of foods high in oxalates, such as spinach, chocolate, and certain nuts, can help reduce the risk of kidney stones. Additionally, reducing salt and animal protein intake is crucial, as diets high in salt and protein can increase the levels of calcium and uric acid in urine, contributing to stone formation. Particularly, it is important to reduce sugar intake, as sugar can also increase the risk of kidney stones. Increasing calcium intake from food rather than supplements is recommended. While excess calcium can form kidney stones, obtaining enough calcium through foods like milk, cheese, and leafy vegetables can help prevent calcium oxalate stones. Managing underlying conditions such as diabetes, gout, or gastrointestinal diseases is also essential, as these conditions can increase the risk of kidney stones. If you have any of these conditions, be sure to follow your doctor's advice and manage your overall health. Timely treatment of these conditions will help reduce their impact on the kidneys and prevent complications. Regular exercise is equally important. Studies show that maintaining an active lifestyle helps the body balance minerals and hydration, thus reducing the risk of kidney stones. Moreover, maintaining a healthy weight will ease the strain on the kidneys and lower the risk of kidney stones. This not only supports kidney health, but also benefits overall well-being. Kidney stones are not just a physical challenge, but also a valuable lesson about health. When you understand the causes, symptoms, and treatment methods, you can proactively protect your kidney health, avoid excruciating pain, and prevent unwanted complications. Don't let kidney stones disrupt your life. If you found this video helpful, don't forget to subscribe to the channel, share it with your friends and family, and turn on notifications so you won't miss any upcoming healthcare videos. Thank you for taking the time to watch, and we'll see you in the next videos.